Good afternoon, everybody. I'm Brad Harbison from Quality Assurance and Food Safety Magazine. I want to thank you for joining us for today's webinar, Hand Washing in the Food Industry, How to Stop the Spread, presented by ASCO. So during the next hour, we hope you will gain a better understanding about proper hand washing procedures and also learn about some of the equipment available that can help keep your business and employees safe. We're happy to have as our speaker Dr. Carol Jones, who has 32 years in the food industry, and Carol is the manager of the Quality Action Team at ASCO Food and Beverage. Carol received her PhD from the University of Missouri in Food Science and MS in Food Technology from the University of Tennessee. She worked previously with the University of Tennessee Dairy Extension Program, Seaboard Farms Pork Processor, QSI Contract Sanitation, Z Chemicals, and R Square Products. And in her current role at ASCO, Dr. Carol performs training presentations, auditing, biomapping, and problem solving for all things related to food safety, sanitation, and micro for food and beverage processing customers, And she is also a certified SQF auditor. Before we start, just one quick note to pass along. We encourage everyone's participation throughout, and if you want to ask questions to Carol, again, we encourage that, and please do so. You can do that by typing them into the question box in the right-hand side of your screen in the module. They will be instant messaged to us. We'll collect them, and we'll ask all those questions at the end. And so with that, I'm going to turn things over to Carol.
Good afternoon, everyone. Thank you for using your time to listen to my presentation on hand washing. And we're thinking about hand washing more in the last 6 months, probably than we've thought about it in the last 60 years. So let's go ahead and see what's up with hand washing. Okay, let's look about what's on our hands. We have bacteria, we have viruses. Most of these staph, we have that on our body. We can pick up E. coli in the restroom if we're not careful. We can, Pseudomonas, that's a spoilage microorganism. And most of these will cause either spoilage problems or they'll cause illnesses, foodborne illness. And then there's these viruses that we can pick up. Rotavirus, these are common with babies. They give very severe diarrhea. And then norovirus, if you're a person that likes to go on cruises, this is where it seems to pop up. And if one person gets it, it seems that as if everyone gets it. So it's very contagious, goes hand to hand, and everybody has gastroenteritis. So it's a very, very contagious virus. And then there's hepatitis A, which you don't hear too much about, but recently in a town near where I live, there was a breakout at a restaurant where there was a person that was working at the restaurant had hepatitis A on their hands. So they touched the plates, the food, and many people were affected by this virus. And then there's the coronavirus, which we know we can pick up off of a surface. And then Epstein-Barr, this is common for like people in their teenagers or people that are just going to college. A lot of times it causes mononucleosis. And then there's herpes simplex, which these are like cold sores, things that you might get on your lip or something sometimes. So they either cause infections or they cause foodborne illness, food spoilage, and they can be on our hands. And we don't really know where we pick them up at. That's the problem. There's two types of contamination. We have the resident flora, and these are the ones that normally live in our skin, but doesn't make us sick. And if we were to puncture our skin without using an aseptic wipe first, then we could get infected with the microorganisms that normally don't bother us. Like say if you were to get an IV put in and they didn't wipe your skin off with an alcohol wipe, you would get an infection from that resident flora. And then there's transient. These are the microorganisms that are transferred to our hands and body, and they're able to cause disease and infections. And this is especially for compromised individuals. But as we've seen with coronavirus, you don't really have to be a compromised individual. You can just, it's very strong, so you can get it anyway. And then the transient, they're loosely attached to the outermost layer of the skin, whereas the resident flora are down a little bit deeper in our skin than the transient. So in our plants, we want to control the contamination. We can eliminate briefly maybe, but generally speaking, we try to control. And we do that by monitoring, and that's through our hands and glove program. We have many signs to wash our hands and our gloves, and sanitize our gloves, sanitize our hands. And then we have people that sometimes stand and watch and make sure that we do that. And then our facilities, we want to make sure who's coming into our facility, where they're coming in at. And a lot of places we have maybe boot washes, we have doorway foamers that, you know, jacks and things like that will travel through to prevent something coming in. And then we do environmental swabs. We do monitoring of the environment. We'll do swabs for Listeria usually and Salmonella. And it's very important that we keep track of where they are in our facilities so that we can eliminate them as we find them, so that they don't get up off of the floor and off of maybe places that they're located and onto our contact surfaces. And equipment. After equipment is cleaned and sanitized, before it's sanitized, we do a pre-op inspection. And we take flashlights and we go out and we inspect and look in all the hard places that it's hard to clean, and to see if we've removed all the contamination from since the last cleaning. And this is very important. And then we look at food products. Sometimes we look at the final product. Sometimes we will pick products from different places in the process to see what kind of bacteria and how much bacteria they've picked up during that process. And this will tell us whether how long the shelf life is going to be, because shelf life and the counts are directly correlated. So the less counts you have, the longer shelf life you're going to have. So, and the more counts you have, the shorter it's going to be. And then we try to eliminate the presence of the contamination. So during our cleaning, whether it's during the cleaning of equipment or cleaning of the facility, the room in which the process is being done, if we clean well all the time, we're going to keep these contamination eliminated. And then we want to, at the most, prevent it from transferring to another object, which we know from many recalls that it will eventually get onto the product. If it's in the environment and we don't eliminate it, it's going to get on the product, it's going to get on the contact surface. It can be brought in on our hands, our shoes. It can come in the air when doors are opened, dog doors, man doors, whenever they're open. Sometimes they're propped open. And then equipment. We might buy a new piece of equipment, or we might buy a new piece of equipment to us that's been used at a different plant, and we might bring in a transient bacteria or microorganism that generally has not been in our facility. And it can find a home in there and create its own little niche and start reproducing. And eventually it will seep out into the environment. And this is when we need to make sure that as we're testing our environment, we're able to pick it up. And because we know that eventually it's going to contaminate the equipment and the environment. So the quality of plant sanitation is key. You know, when employees come in to go to their line, after sanitation's over, they've cleaned, they've pre-op, they've sanitized. Employees expect that anything they touch has been cleaned, and they should be allowed to touch it. They should not expect to get contaminated by touching something. And so it's very important that those employees are able to touch equipment, it be clean, and they keep their hands and gloves in a clean condition as they do their job. And especially those that touch near contact surfaces and those that touch food contact surfaces or the food itself, because the risk is very high right there. I received a call from a chicken plant, and they told me that they had, I think it was chicken breast, and they were putting it on a tray pack and wrapping it, and then in 3 days it had visible white colonies growing on it. Well, that told me, first of all, that there's a serious bunch of contamination going on here. And so I went over to the plant, and I went in about maybe 11, and it was, second shift was still going. And in this room, I think this was where they were putting breasts on a tray pack. And there were 2 lines, but only one of them was running. And it was close to the end of the shift, it was running slow. And so I watched the women. They were standing here in front of 2 conveyors. They were side by side, and one was carrying a tray pack, and one was carrying the breast meat. And so they would pick up the breast meat, put it on the tray, which was about waist high, and then they would lift the tray pack up about shoulder high and put it on another conveyor, which went to tray pack wrapping, and it would get wrapped and was gone. So I watched them for a little while, and then they would bring their hands back down and put them against the side rail of that conveyor and just rest there. And when another piece came by that they needed to pick up, they would pick it up, position it on the tray, and then again put it up on the overhead conveyor, and then come back down and put their hands against the frame of the conveyor. So they all did that, and I watched them for a while, and I thought, okay. So I walked over and I looked at the other line that was not running, and I pulled up the belts and I pulled up the wear strips, and it was nasty. I mean, it was gross nasty. And so I figured probably that other line is just like it. So I waited, hung around till the shift ended and the ladies left. And then I went over and I pulled up the belts and the wear strips, and it was the same gross, nasty mess. So the women unknowingly were inoculating all the chicken, because all this nastiness was there, and it was just too much. It was overrunning everything. So every time they touched it, they put it, and they contaminated their gloves, and they contaminated the chicken. So when the sanitation manager came in, I said, okay, how long has it been since you took these belts off? And he said, I don't think they've ever been taken off since I've been here. And I said, well, let me show you something. So I showed him the issue. And then we backtracked all the way back to the beginning of cut up, and it was contaminated all the way back. So what we did is we took the belts off, we took the wear strips off, we put them in tubs to soak in detergent, and we scrubbed down the frame, and then we scrubbed the belts, scrubbed the wear strips, sanitized the frame, and then put rinse the belts off, rinse the wear strips off, and then put them into soak and sanitizer, and then we put them back on. And of course, their issue immediately stopped. So, and then they went on to take all the belts off in the whole cut up, because, they hadn't been taken off either. So, it makes a difference how sanitation does their job. And if they don't do their job, there's no way you can have a good shelf life. Okay, the purpose of hand washing. It's, of course, to remove anything on our hands. It doesn't matter what it is, whether it's dust or dirt or ingredients. It might be food particles. It could be a sneeze droplet or a cough. Anything that's on our hands that we've transferred there, or it could be microorganisms that have grown inside our gloves since we put them on and went to work. So maybe we've been at our site for 3 hours with our gloves on. So there's something that is going to be growing inside your glove because it's moist, it's damp, it's warm, and bacteria, microorganisms are going to grow inside your glove. And then we want to remove and reduce levels of potentially pathogenic or spoilage transient microorganisms that we've picked up since we washed our hands last. So hand washing is a simple concept. It is, it's simple. Anybody can do it, but most people don't know how to do it. So we need water, we need soap, we need some mechanical action, same way you need to clean anything. We need some time, and then of course we need to rinse it. And then we need some way to dry our hands. And then finally, as good as it ever gets, we apply sanitizer to our hands, and this is clean as our hands will ever be at this point right here. So it seems very simple, very easy to do. However, our hands are not clean. And as we look at this slide, I want you to take a good note of this slide, because as we look at this, we see most frequently missed our thumbs, in between our fingers, around our nails, the tips of our fingers, and then the creases on the palms of our hands. Plus, the frequently missed is a major part of our hands also. So we don't do a very good job on any part of our hands. So, this is really major. I had no idea that it was so bad. So when I decided that they asked me to do this presentation, I've seen these slides before of pictures of petri dishes where they've done tests and stuff, but so I called Nicole up in Chambersburg and I said, Nicole, I need some petri dishes. So she sends me 10, and I labeled them all consecutively. And over a 2-day period, I did these tests, and they're not consecutively done, however. And I didn't do anything special. I didn't try to make them one thing or the other thing. They just were what they were. And again, I did them over 2 days. So, but number one is number one. And it was my dry, unwashed hands. And I don't know how long it'd been since I washed my hands, but they were pretty dirty. And I was kind of surprised at what was on my hands. And then number two, this is and these were some of these petri dish samples that I took they were just okay, like, what if I did this and what if I did that? It wasn't anything complicated that I tested, but I rinsed with water and dried on a paper towel, and then I sampled. And as you see, it's dirty. I didn't really get much off my hands by doing a rinse. It didn't work. And then number three, I washed briefly with soap. I dried on a paper towel, and this is what I come up with. And like I said, I don't know, I didn't keep track of when I sampled these, what time of the day or anything. So this one is actually not too bad. Number four, I rinsed my hands, I used soap, and I did a good 20-second scrub like you're supposed to. And I dried my hands and I tested. And there's still bacteria on my Petri dish. So, you know, everything didn't come off there. Now, number 5, I want you to get this one. This is a really important one to remember. Sanitizing unwashed hands. And you see that there's a lot of stuff growing on this Petri dish. And, you know, when we sanitize anything, we're supposed to be sanitizing a clean surface. And so it's important that, you know, we try to get all the load off before we sanitize. And obviously, when we sanitize unwashed hands, the load is still there, the load is heavy, and we end up with bacteria or microorganisms still left on our hands. And then number 6, this one, I washed with soap, normal, and I sanitized, and then I put on gloves and I wore them for 2 hours. I went shopping. I think I got gas. I carried my groceries in, and I drove, I don't know, maybe 30 miles. And anyway, I wore the gloves to simulate like what a person would do in a production plant. And then I pulled my gloves off and I touched the plate. And as you see, something, probably my middle finger, was really, really nastily contaminated. And, you know, I've always taught GMPs, teaching people that when you take your gloves off after you've been out on the line, make sure you go and wash your hands before you go grab your sandwich. Your hands may look clean. You've had gloves on, your hands, you think your hands are clean. They're not, they don't have any product on them or anything like that, but your hands are really dirty at that point. And this proved that. This number 8, I rinsed with water, dried my hands, and sanitized. And again, it just doesn't work. It just doesn't work. We need soap. We need soap to get down there and remove and loosen that stuff off of our hands. And number 9, this was, I washed my hands. They were what I thought was clean. And then I coughed into my hand maybe 3 or 4 times, you know, kind of like a kid when they're faking coughing. And that's what I did. And I wasn't sick or anything like that, but this is what showed up. So, you know, a cough, it makes a difference. If we're going to cough into our hand, we're going to sneeze into our hand, we definitely need to wash our hands and sanitize. And then number 10, this was after I had washed my hands and sanitized, and then I plated my knuckles. And I found out that they were not clean either. And then finally, I washed my hands with soap for 20 seconds. And I sanitized all over my hands with really good, sanitizer completely covered my hands all over. And you see there is no growth. So, you know, I've been in the food industry a long time, and I'm a very diligent food safety person, and I care about food safety, and I care about hand washing, and I always thought I did a good job. I really did. I always thought that I did a good job. Maybe other people didn't, but I thought I did. And I was really shocked when I saw these Petri dishes, and I realized that I wasn't doing as good a job as I thought I was. So I have now changed my ways, and I'm now washing my hands much better. So here is a mechanical action that's required to wash your hands. You put your palms together, you rub your palms together, then you put your palm or on top of the back of your hand and you rub that way, and then you switch and put the other one up there. And then you rub between your fingers and get the sides of your hand. And then the other one is you rub around on your thumb, make sure you get your thumb and the part between your thumb and your finger, all that clean. And then the middle one here, this one is a good one to clean your knuckles and also to clean the tips of your fingers and around your fingernails if you do this. And then the last one, this is a good one to clean the creases of your hand and also your fingertips. So, and here's the thing, you know, we teach GMPs all the time about hand washing, washing your hands and all this. But, you know, I realized that I don't think all my years in the food industry, I don't think anybody has ever taught me or I saw a demonstration of how to wash your hands. And I was actually pretty shocked that, you know, we don't have training on this. We just tell people to wash our hands. And I don't remember when somebody told me how to wash my hands. So now I know how to wash my hands. And I think that we should be adding this picture and a demonstration, a physical demonstration in front of people, employees, on how to wash our hands. And so they will know, and they will, you know, not be like me thinking they're doing a good job and they're leaving most of their hand dirty. So I think this should be added to the GMP training. Sometimes I do audits, and a lot of times after sanitation is over, I like to watch setup, and I'll go in and stand against the wall and I'll just pick out somebody because they're going to be moving stuff around and getting things ready for the regular employees to come in and start to work. And so I'll just randomly pick somebody and I'll follow them around for a while and see what they do, see what they touch, what to pick up. And then maybe I'll find somebody else and watch them for a little while. And also do this during production because sometimes people do stuff that they don't realize they're doing. And, you know, maybe they bring out ingredients and then they reach down and move a pallet. And then what do? Do they go and sanitize their gloves, or they change gloves, or they wash their hands? What do? That's what I want to know, because I'm looking for holes in their program. I'm looking for people that are doing something that they're not even aware that they're doing, because people are trained, but after a while, you know, nobody's really watching you every move to see what you're doing. They're just, you've got a job to do and you're going to do it. But sometimes we do stuff that we don't realize that, oh, I just contaminated my hands. And in the food industry, gloves are very important for us because we wear them. And this is another thing. I'm not sure that all employees understand that gloves are there to protect the food. It's not to protect them from the food, it's to protect the food from them, because we know we have contamination on this. So we want to make sure that the product is what makes money. The product is what makes profit. The product is what pays the bills. So we want to make sure that it is kept safe for the consumer. So gloves for the food industry is very important. And I think sometimes the employees don't really understand that. They think the gloves are there to protect them from getting food product on them. And meat and poultry, RTE, ready to eat facilities, I think from my experience, they have the most stringent donning and hand washing protocols that I've seen. I mean, they have a list of what you do first. You know, you put on your glove, or you put on your boots, you sanitize your hat, when you put your frock on, when you put your arm sleeves on, when you wash your hands, all these things, they have a specific order, and they do have people that monitor and watch. And probably the last thing you're going to do is put your gloves on and sanitize them before you enter that food processing area. And they do swab. They will swab during production to see if you've picked up anything. So in the food industry, looking at what I've seen. What I think the biggest deficiencies are is just going through the motions. You know, they tell us to wash after break, we wash after break. Wash after we go to lunch, wash after we go to the bathroom, wash before we come to the floor. We do all these things, but we're not thinking about why we're washing. We're just, they told us to wash and we're going to wash. And we're not washing adequately. We're not washing our hands totally and getting all those places that that slide before showed that we don't hardly, I mean, who thinks about washing their thumbs? Well, I don't. And then the third one is incomplete sanitizer coverage. You know, just because you stick your hand under the sanitizer unit and it sprays out some sanitizer and you rub it against your hands doesn't mean your hands are sanitized. That's an illusion. If you want to say your hands are sanitized, you have to sanitize the entire hands. And that may take more than one sample of sanitizer. You may need 3 instead of 1 in order to get total coverage. But what I think we do well is we wash often, and we wash as a unit, generally speaking. We have a system that says, you know, after you go to break and everybody goes to break at the same time, everybody comes back and washes their hands at the same time. So it's a system that we have. Now I realize that sometimes, you know, a person leaves a line and goes to the restroom and comes back and it's a single individual, they've got to wash their hands. But generally speaking, food production employees are going to do things as a unit, and that keeps it so that it actually happens. So I think that's a really good thing that we have in the food industry. So what happens when hands are not washed well and they're not sanitized properly? 2.4 million people will acquire hospital infections every year. That means 1 in 10 people that go to the hospital are going, if they stay 2 or 3 days, they're going to acquire an infection they didn't have when they went in the hospital. And according to the CDC, these hospital-acquired infections contribute to 70,000 deaths and are directly responsible for 30,000 deaths every year. And they contribute this to cross-contamination of hands and contaminated gloves. Now, why are hands contaminated when they go to a patient? Why are they contaminated? Because healthcare workers don't wash. They don't wash their hands. And these are some of the reasons they give for not doing that. Well, they say they don't remember. Okay, in the food industry, we've got signs everywhere, in the bathroom, in the break room, in the cafeteria. When you come to the floor, there's signs everywhere telling you to wash your hands. And they say they don't remember. Or it takes too much time. Okay, here's the deal. If you wash for 20 seconds and you rinse for 5 seconds, and then you dry maybe 10 seconds, and then you sanitize maybe 10 seconds. That's less than 1 minute that it takes you to do that whole procedure correctly. Okay, I'd rather them take that time before they come to me. They say they create adverse skin conditions, so they don't want to do it. Now remember, we have a system where all people wash at the same time. Well, these people are just individuals. They wash whenever they need to or think they need to. So they don't like the products. They don't like the soap products, so they don't wash. They say it's not convenient, and that they have a high turnover, and they don't have time to train people, and they've got a shortage of staff, so they've got all this extra work to do, and they don't have time to think about washing their hands. They just have time to go from patient to patient to patient to patient, cross-contaminating everybody. So when do they wash? When their hands are visibly soiled. Okay, if they've got blood on their hands, they'll wash their hands. If not, unless they've got feces on their hands, they don't wash their hands. They don't wash their hands between patients, not after they change gloves, not before putting on gloves. So you know that their hands are dirty before they put the gloves on, and their gloves are probably contaminated after that. So only about 40% of the time when they're working with a patient do they wash their hands. And usually it's not an adequate wash. They just go through the motions. I got to wash my hands, so here I go. Quick lather, quick rinse, I'm done. Good job. And they use gloves and sanitizers as substitutes for doing a thorough hand washing. And we remember from my slides, it doesn't work. They've been using alcohol-based sanitizers, which are great, since 2000 now. That's 20 years ago. But the prevalence of these hospital-acquired infections has not went down. So they're either the load is too high on their hand and the sanitizer can't beat it, or they're not getting the coverage, or there's some issue here, because we know sanitizers work, but it's not working in these hospitals, in these healthcare places. Okay, let's talk about what we can bring to work. Serratia marcescens, this is a bacteria, and it's famous for contaminating wounds. And in this case, it was traced to a jar of exfoliant cream of a nurse. And guess what? It was carried under her false fingernails. Well, in the food industry, false fingernails are not allowed. So we're better able to wash our fingers and wash under our nails than they obviously are. Okay, Malassezia pachydermatus. This was a yeast that was transmitted by a nurse to infants in the ICU where they worked, and it was on her hands, and it came from her dogs, and she transferred it to little babies that were sick and in the ICU. So, hand washing is a serious business. It may be a simple concept, but it is a really serious business. Also, they found that gooseneck faucets, which were in all hospitals, they were directed straight down into the drain. And what happened was they created this splash of these tiny droplets that had bacteria connected to them, coming from biofilms that were in the drains. Now, we know that in a hospital, they pour urine down a drain, they pour extra antibiotics that they don't need. That bag gets emptied down that drain, creating antibiotic resistant bacteria down in that drain in biofilms. So now those bacteria are coming back up, and it's spraying on the person, it's getting on the nearby prep area, it's getting on the equipment or that's going to go in the patient. So like a catheter, you're going to get a catheter put in, and it's got stuff from down that drain, no telling what is in there, or a ventilator going in your lungs, and it's going to be contaminated. In just a little bit, you're going to be sicker than you were to start with. But Vanderbilt University Medical Center, they finally take some action. There was a doctor, he worked at Vanderbilt, and he was in the hospital with his wife. She was getting ready to have surgery, and he was just sitting there watching the healthcare workers as they came and went and tended to his wife. And he saw over 60 instances where the healthcare workers neglected hand hygiene. And as soon as she got out of the hospital, he went back to work, and he and a bunch of other doctors got together and put together a hand hygiene program. And this happened in 2009. And they started with training, and they trained every single person associated with that hospital. I mean, from the receptionist at the desk to the people who are the mechanics, who the HVAC people, every single person got trained on how to wash your hands, how to sanitize, and when to do it. And they communicated this to everyone. So if you were a new consulting doctor coming in to work on a special case, you got this training too, and you were held to that. And they communicated to everybody, and so everybody was watching everybody, not like before when you just did your own thing. So now people are watching everybody to see that they wash their hands when they're supposed to. And what they told people was, if somebody tells you you need to wash your hands, then the only thing you can say is thank you. You cannot get mad at them. You cannot get frustrated, because this was a serious issue, and it was communicated in that way. And they were held accountable. They looked at each department to see where the infections were coming from, the ones that were hospital acquired. You know, who was responsible for that? Who was tending this patient that got this infection? So everybody, they really did well. And by 2014, the bloodstream infections from central lines dropped by 80% in the ICU. And isn't that a great place for infections to drop? You know, people that are really sick in the ICU don't need a bloodborne infection. And then ventilator-acquired pneumonia decreased by 61%. So hand washing, this is just due to hand washing and sanitizing properly. You know, it's major. It seems simple, it's a simple concept, but it has major effects. Okay, let's look at children in schools. And, you know, as an adult, I look at it and I say, well, if I didn't know how to wash my hands properly, I'm sure there's many, many other people that don't know either. And I should not expect a little child to know how to really wash his hands like we should. So, you know, sometimes I've washed little children's hands, and, you know, you put your hands in their hands, or they put their hand in your hands, and you rub them together and you turn them over and you wash them as good as you can. But their hands are actually kind of hard to wash, and to help them wash them is not the easiest thing. And they like to play in the water a little bit. And so what I recommend with little children is, after they wash their hands as good as you can, is to use a sanitizer wipe and go over their hand really, really well. Because we know that when one child gets an infection, everybody gets it. It goes from one person to another person, and you don't know where the little child got it, but they got it from somewhere. Okay, let's talk about bulk soap refillable dispensers. Studies have shown that at least 25% of all bulk soap refillable dispensers in the public are contaminated. And in 2011, the elementary school was contaminated with Serratia marcescens. Now remember, that's the one that causes wound infections. So if you're a little child and you've been playing on the playground and you fall down, you skin your hands, and you come and wash your hands with the soap, now you've got Serratia marcescens on your skin and could cause a really bad wound infection. All 14 dispensers in the school were contaminated. So I recommend using replaceable units as much as you can. And ApcoZep, we have touchless dispensers and replaceable units. So I recommend, you know, calling your ApcoZep rep and see what they can do for you, because so that you keep your soap clean. Okay, use more soap. I'm not a chemical rep, so you can't blame me if I tell you to use more soap. But it is important that you use enough soap. So this study showed that 4 pumps of foaming soap removed more microorganisms than 1 or 2 pumps. And so the greater volume of soap that you use, the more microorganisms you were able to get off. So don't be stingy with your soap usage. You may need more than 1 squirt, you know. Whatever you need, that's what you should use. So use more soap. And the longer the students washed, the more microorganisms they got off. So they compared 5, 15, and 30 seconds washing. And they found that with 30 seconds, more microorganisms were removed than with 5 or 15. And we do in the food industry 20 seconds. At least we say we do. And I think that's another point that we could work on in the food industry, is making sure that we do wash for 20 seconds, not 15, not 5, not just go through the motions, do a quick wash and rinse and we're done. Actually do a 20-second wash. And then the type of soap. This study found that using antimicrobial soap versus non-antimicrobial made a difference, that they got a greater bacterial log reduction from the antimicrobial soap. So, you know, we have some antibacterial soap that we offer, and we do have an E2 type soap sanitizer that we offer for the food industry. And I know that I love to go in TJ Maxx and look at their soaps and smell of them, and the packages are beautiful and they're just lovely. But none of these are antibacterial or, you know, antimicrobial, but they're still soap, meaning they will remove soil. So whether it's bacteria or whatever, they still will remove it. And then drying your hands. I recommend using a clean paper towel. And using an automatic towel dispenser, I think, is the best, where you just wave your hands under it and the paper rolls out. Now, in the food industry, there's several places they have the paper towels where you have to reach up with both hands and pull down each sheet. But sometimes those things jam, or somebody tears the paper off and there's no paper left. So you've got to reach up, turn that little knob on the side, and now your hands are contaminated. So the automatic ones are the best, so you don't have to touch anything. And sometimes you might stop at a rest stop, or a restaurant for that matter, and you go in and you wash your hands and you realize there's no paper towels and there is an air dryer. So you go to the air dryer and you use it, and maybe it's one that's blowing toward the floor and it buzzes along, you know, and finally you rub your hands for a while and finally you just say, forget this, and you wipe them on your jeans and you reach for the door and realize that you're going to have to touch the handle that everybody from here to yon has touched, and you have no idea what's on that door. So you're going to go out that door and you're going to be really contaminated. So that's a bad situation. And it's better to leave your hands dirty and dry than dirty and wet, because whatever is on your hands, if they're wet, you're going to transfer it everywhere you touch. So, you know, if there's no soap, if there's no way to dry your hands, just leave your hands as they are and go on. You can wash them later when you get to a more convenient place. Okay, remember that hand washing removes microorganisms from the surface of your skin, and just a little dollop of sanitizer is not a substitute for effective hand washing. Remember my plates? It just doesn't do the job. After you hand wash, apply sanitizer all over your hands to kill the remaining microorganisms. You know, sanitizers are not meant to kill gross soil, you know, gross loads. They're meant to kill remaining microorganisms. So we have some alcohol sanitizer sprays, and they're touchless, and you may need, you know, 2 or 3 squirts in order to get it to cover your entire hands. But make sure that you cover your entire hands. Don't just get some on your hands, rub your palms together and say you're good to go, because that's an illusion. You have not sanitized your hands at all. Okay, do yourself and everybody else a big favor. Always be cognizant of the reason that you're washing your hands. Remember the bacteria, remember the microorganisms, remember the viruses that you might have picked up. Going through the motions doesn't work. Seriously, wash your entire hands with water and soap using all the right moves, and wash for the full 20 seconds. And rinse thoroughly. Make sure you get all that soap and all that dispensed soil that's in those bubbles rinsed off. A good dry, and follow with complete sanitizer, complete coverage. You see my little brush. This little brush was, I found this, and I was telling my uncle about this, one of the pictures where it showed what we miss when we wash our hands. And he's 86, and he said, I know how to wash my hands. And I said, you do? He said, yeah. He said, I was an intern in the Army, and they taught us. And I said, well, how do you do it? And he says, with a brush. He said, we had no gloves, and we had to get our hands clean. So I found this brush, and at least probably 2 or 3 times a day, I use it every day. And it's really great. It gets under my nails. It gets all over I rub it everywhere, all over my hands. So I know my hands are much, much cleaner now. And I know I can't take it to work, but when I'm at home, whenever I can use it, and I can remove everything off my hands. So it's a great tool. So don't be the one who transfers a potential pathogen or a spoilage microorganism to the food, a contact surface or packaging, or even a sterile piece of equipment to a friend, a little child, or maybe your coworker, or to every surface that you touch every day that somebody else is going to touch. So wash well, wash often, please. And thank you for attending my presentation. I hope you can take something away that will be beneficial to you in your operation. And if AAFCO or ZEP can be of service, please contact us at this number or at aafcocare.com. Are there any questions?
Hey, Dr. Jones, great presentation. Got a lot of great feedback from folks on the call, and quite a few questions as well. And I'm glad I didn't see those Petri dish photos there before lunch today. So, first question we had here was, double hand washing is utilized as a mitigating step after use of the restroom by food handlers. Once washed in restroom, and then they return to their workstation. Have you looked at this process improving bacterial viral load on hands?
Okay, they wash their hands in the bathroom, and then they come out to the production floor and wash their hands again.
Yes.
Okay. Well, I think that's good. I think that's a good practice to do.
Yeah.
Yeah, I do.
A question, somebody really liked your slide on the mechanical process when hand washing. Is this process available on a poster?
I've not seen it, but I think it would be a great one.
Yeah, definitely. We had a couple folks ask questions about water temperature. One was, is it necessary to use warm water for washing hands? You want to take that one first?
I think the water temperature is mostly the comfort to the individual. I mean, you can wash your hands in cold water. You can wash them. I mean, there is a temperature that you can't get. It's too hot. But I think it's just a matter of comfort because you only have your hands under the water to get them wet and then to rinse off. So I don't think that's a big deal.
And the second question was similar, but a little bit different. They asked, is warm water truly more effective in removing soil than cold water? And if it is, what is a recommended temperature range?
Mm, I mean, I don't think it should be freezing, but I don't think you have to use warm water. I think you can use cold water. Like I said, nobody likes to put their hands in freezing water, but it's just for a very short time, and I really don't think it makes a big difference.
Uh, just some feedback said, excellent presentation. Really shows we have been thinking that it says, it says excellent presentation, and it really shows that we have been thinking that what has been working for years without looking at in-depth the results of hand washing. Congratulations, well done. So.
Oh, thank you.
And then absolutely agree with you that hand washing should be mandatory for hospital and hospitality staff. Hand washing is as simple as ABC. Let's see what else we have. Bear with me for a second here. A couple just rolled in while we were doing the Q&A. Somebody mentioned that WHO has a hand washing poster similar to your photos.
Oh, really? Okay.
Yeah.
Well, I think we need to spread that around.
Absolutely. Absolutely. Couple questions were for us, and that was some folks wanted to get a copy of the webinar. Yeah, we are recording the webinar. It'll be available on the QA Magazine website, and we'll also provide a copy to AFCO-ZEP, so you can talk to your rep and get a copy for them as well. Let's see here. Okay, a question came in. It says, if you don't have paper towels and you have to touch the doorknob, can you use hand sanitizer after you open the door? When you may have with you, for example.
Sure. that's that's about all you can do.
Yeah. A question was for employees who are required to wear gloves before handling product, should the gloves be washed and soap before sprayed or dipped with hand sanitizer every few hours?
That would be good. Yes.
Okay. Let's see. It just says, from my personal point of view, I wouldn't suggest to use a brush unless it is very personal item not to share with other people.
That's correct. That's definitely correct.
Uh,
But at home, that's a good place for it.
Absolutely. This again, somebody was helped out with the poster. If you go to the WHO website and you search for hand hygiene, why and how and when brochure, for folks out there that are interested in that resource. You know what? I think that looks like that's it. I think we got through all the questions there. But Dr. Jones, thanks again for a terrific presentation. Got a lot of great questions and a lot of great feedback from our listeners. And we want to thank AFCO-ZEP for presenting this and sponsoring this and presenting this webinar. And again, for our listeners, we will have this posted up on the QA website, and you will get a copy of it. And with that, I'll just kind of turn things over to Dr. Jones. You can take us out here with a couple final words if you want.
It's just great to be here, and I appreciate everybody that took the time to listen. And again, I hope you found something in here that will be beneficial to you and your operation, that will make you have a better hand hygiene program.
Great, thanks. And again, thanks to all of our listeners for taking some time out of your day to be a part of our event. Have a great day, everybody.
Thank you.